What to expect during diverticulitis abscess drainage recovery. Imagine dealing with a painful pocket of pus caused by diverticulitis that just won't go away with antibiotics alone. When that happens, doctors might suggest abscess drainage, a minimally invasive procedure that can bring relief. During this process, a small tube called a catheter is inserted through the skin into the abscess, guided by imaging like a CT scan or ultrasound. This allows the pus to drain out safely without the need for open surgery. After the procedure, most patients stay in the hospital for a few days. This period helps doctors watch for any signs of complications and make sure the abscess is draining properly. The typical hospital stay ranges from about 4 to 8 days, depending on how severe the abscess is and how well the patient responds to treatment. Some patients with smaller abscesses or stable conditions might be treated as outpatients, but close monitoring is always essential. A small drainage catheter usually remains in place for around 8 days. It stays there to keep draining the pus until the infection clears up. During this time, the catheter may need occasional flushing or adjustments if it becomes blocked or shifts position. Patients might notice some mild discomfort or tenderness around the catheter site. It is common to experience some mild abdominal pain, minor bleeding, or even diarrhea. Pain medications and antibiotics are typically prescribed to help manage these symptoms and fight the infection. Once the drainage is complete and the infection is under control, follow-up visits are crucial. Your healthcare provider will check your progress, and imaging tests might be repeated to confirm the abscess has fully resolved. When the doctor is satisfied that healing has occurred, the catheter is removed. While abscess drainage is generally safe, there are some risks to be aware of. These include infection at the catheter site, bleeding, or accidental injury to nearby organs. Sometimes the catheter may become blocked, or the abscess could come back, which might requiring repeat drainage or, rarely, surgery. Many patients recover fully after drainage and antibiotics. However, some might need elective surgery later on to remove the affected part of the colon. This step helps prevent future episodes of diverticulitis or complications. Usually, surgery is considered within weeks to months after drainage if the patient is a good candidate. The entire recovery process typically takes about 2 to 4 weeks. During this period, it is important to follow your doctor's advice on diet, activity levels, and medications. You can expect a gradual return to your normal routine as your symptoms improve. In summary, recovering from diverticulitis abscess drainage involves a hospital stay with a drainage catheter for about a week, managing symptoms with antibiotics and pain relief, and regular follow-up care. Most people avoid surgery with this approach, but some may need it later to prevent further problems. The procedure is less invasive than open surgery and generally allows for a quicker recovery, but close medical supervision is key to ensuring complete healing and avoiding complications. Always consult your healthcare provider for personalized advice and care.